While the governor is preparing to lift the state mask mandate at the end of the month, the Chicago Department of Public Health is pumping the brakes on the push to lift restrictions in the city.
WGN's Julian Cruz is live at City Hall right now with more on that. Julian.
Well, Lourdes and Ben, as you know, the health department eyeing the possibility of lifting certain Chicago mitigation efforts, such as the requirement to show a proof of vaccination in order to get into a restaurant or a bar or any place that serves food or a health club. But Dr. Allison Arwady with the Chicago Department of Public Health says it all depends on the numbers.
I will be honest with you, we are going to hit we need to hit those metrics.
Dr. Allison Arwady in the Chicago Department of Public Health says it's not about choosing a date to lift mask or vaccine mandates.
So I think next week, when we stand up and we look at where things are, we'll be able to give a more definitive answer.
Arwady focused on 4 key metrics and continuing declines in new cases, which is about 431 cases per day right now, continuing improvement in citywide positivity rates down to just 2% now, with falling numbers of hospital beds occupied by COVID or Omicron patients and the number of ICU beds.
And as we drop under that 400 cases per day, that's when we move from high into the substantial or moderate risk.
Arwady says 3 of the 4 risk metrics must reach lower transmission risk and remain there or decline for an incubation period of at least 2 weeks. Now, yesterday, Mayor Lori Lightfoot essentially indicating that the jury is still out on whether or not the city will be able to lift those mitigation efforts by the end of the month. Once again, the mayor saying it all depends on the numbers. At City Hall, Julian Cruz, WGN News.